think one of the most consistently fascinating things to me in veterinary medicine is how translational it is, how relatable it can be for a human being to look at a creature that does not speak the same tongue as them, that, in theory does not have the same types of, I guess, the same way. We don't process things the same way, as in we don't translate things the same way. If I look at an object in my brain, I comprehend it in a certain way, but an animal might do it differently. And so being able to kind of mesh the study of animal medicine and translate it over to human medicine and allow advancements to be made in both of those fields at the same time has been extremely rewarding. And it's just nice to be able to operate as a public health figure, as a confidant, and as someone who's able to maintain the importance of healthy pet ownership, which at the end of the day endorses healthy societies as well, not only in terms of mental health, but physical health as well, understanding what kind of diseases can pass between humans and animals and having a really good knowledge base of that. So it is a very translational field. And there is a concept called one medicine, and one medicine is essentially that, kind of bringing to light that human medicine and animal medicine at the end of the day is medicine. The studies are the same and they intertwine in ways that synergize each other. And so I think that to me keeps me extremely engaged within the field.
Wow, that's a lot. I mean, I think definitely at times you think that for a human, for example, doctors, they probably witness all sorts of diseases and disorders and see their patients in pain, or they may become very invested in a specific patient's health. They have an amazing story. Whereas with animals, obviously you can't maybe learn what their story you can't comprehend their experience at their level, but you can probably still see if an animal is visibly in pain. Do you ever feel emotional when you see an animal in so much pain that it brings out your emotions, it hurts you? And is there an emotion tied to expertise in the veterinary field?
Absolutely, there is. There's so much emotion to it. And actually, to your point of not being able to, and I'm sure that this isn't directly what you intended, but it is kind of a common misconception that people have that animals don't express pain visibly to us. They absolutely do. They just express them in ways that have to be studied and understood, and they are extremely nuanced. And to the untrained eye, you might not be able to pick up on it, but there's a reason why a mouse grimace score exists, because when you're in a laboratory and you're conducting experiments on lab mice, you have to be able to tell when that mouse becomes too uncomfortable to continue on with a study. There is a code of ethics that goes under that. And so when it comes to animals that are, that fall under the umbrella of pet ownership, it's learning to understand the micro changes that this animal might be going through in terms of its behavior, in terms of its, it's just generalized existence and how it is expressing itself to you in order to understand the needs of this animal. And so I respect that veterinary medicine is 9 times out of 10 a very holistic approach to medicine. You're not just kind of looking at this is the ailment that my patient has come to me and expressed verbally. I go to the doctor and I say my knees hurt, and the doctor says, okay, well, let's focus on your knees. But I have an animal walk in the door and they have a limp on their left leg, and I do my exam, and only in touching the animal, watching them walk, running certain diagnostic tests, etc., am I able to figure out this animal actually has Lyme disease and it's limping because it's got joint inflammation. So it's just like, it is a very complex tunnel system of learning to trust your intuition and learning to open your eyes and listen better like see better what's in front of you, to better understand what's happening at the level of a creature that can't actually communicate with you in English or a human language.
And that's why I always text you when my cat has something sus going on that, hey, Sahar, I don't understand what's happening with my cat, but this is just out of the norm. Can you tell me if, the cat is in pain or the cat has some sort of sickness or illness? So I think obviously we can notice that something's wrong, but we can't understand what is wrong. And that's where your specialty in veterinary medicine comes in, that, hey, we can pinpoint what the actual issue is. Same thing maybe with a physician for humans. If I'm having a fever or I'm vomiting or feel nauseous, sure, I can identify the symptoms, but I don't know what's causing it. And would you say that it's differs from animal to animal, what symptoms they may show, but it could be the same sickness? Like, I'm sure there's a difference between how a horse shows it's sick versus how a cat shows it's sick, and so on.
100%. Not only does it differ between species to species, but it's going to differ between individual animals within the same species, because every animal, just like people, has their own personality, has their own comfort level. I think it's important to understand that when you're dealing with most animals that we work with, they all have a wall that they put up, because at the end of the day, an animal's priority is survival. And it's the most primal instinct that we all have. So us as animals, our most primal instinct is survival, but that instinct is shrouded by societal norms and expectations and whatever might be out there. But when you're dealing with a non-human animal, all of those nuances are stripped away, and you're dealing with that primal instinct, which is survival. And so an animal's first instinct isn't to show you that they're sick, it's to show you that they're okay and they're going to get by and there's nothing wrong with me. Because if you figure out that there's something wrong with me, then I have less of a chance of survival and you are potentially a threat to my life. Of course, with the domestication of animals, they've learned to acclimate more to coexisting with us. And so there is kind of a trust barrier that has been broken down maybe a little bit, especially when it comes to cats and dogs, for example. But I think cats are a really good example of how primal instincts live on and how they differ from animal to animal. So I can have a cat present to me where the owner says, I haven't seen them use the litter box in a week, and I can run some tests and find out that the cat has a tumor growing in its abdomen and the owner had no idea, and the cat has 2 weeks to live. I can have a cat that presents to me for the exact same thing. And I can run my tests or even just do a physical exam and figure out that this cat is just being picky and hasn't eaten its food for about a week, and so therefore has gone to the litter box less. And so it's just kind of like learning to ask the right questions and learning to default on conducting a thorough physical exam every single time, which is something that I think human medicine has fallen short in, which it's fallen short, to be fair, in many, many ways. But in this most basic way is the physical exam. In veterinary medicine, it is understood that no matter what, you always conduct a full physical exam, because an animal's not going to be able to tell you where something hurts, or they're not going to be able to verbalize what kind of symptoms they've been feeling and in what frequency. In human medicine, the complete physical exam, in my experience at least, does not exist. Asking questions about a lifestyle, asking questions about dietary habits, about activity, about family history in a more intentional manner, rather than just kind of filling out a checklist, does not exist anymore, because human medical practitioners simply do not have the time and the resources to be able to practice medicine in the way that it should be. Veterinarians, for now, in most places, we try to make that time. But that's starting to change a little bit as well.